want a ventilator, and when they told me that she needs to be ventilated and that they're trying to get her transferred, and because they don't have none there, it was really shocking to me. You get me? And it's really sad to know that there's no ventilator at the hospital.
Bless up my people. Welcome back to the channel. It's a girl and Isabel Rose. Thanks for all the new subscribers. Thanks to the returning subscribers. If you're new to the channel, subscribe. Turn the post notification bell on. Put it on all so you won't miss an upload from me. On the road to 20k. Help me to get there, my people. Some people, after we learned over a week ago where a 4-day-old baby had died at the Mapen Hospital due to a lack of ventilator, right? Couldn't be transferred because there wasn't any trained personnel at another institution that had a ventilator to get the baby on it for care. And so a mother had to watch her baby take that last breath, despite of doctors trying their best tirelessly, manually. Basically, if you use them hand, my people, to keep this baby alive. And so we see a second mother coming out, my people, with an 8-month-old baby who desperately needs a ventilator, is fighting to stay alive at the Mapen Hospital in Clarendon. The infant has been incubated at the hospital for about 3 weeks. Right? The mother of the infant says she was advised that the hospital does not have a ventilator on the pediatric ward. And we had heard the opposition spokesman on health, Alfred Dawes, basically asked Chris Tufton of some 105 ventilators that they got during the COVID-19 era. And so the Minister of Health had indicated there were approximately 118 ventilators in use in the public healthcare system. The mother admits the hospital has been trying to secure a transfer for her daughter. However, all efforts so far have been unsuccessful. News media contacted the hospital's leadership. They confirm attempts are being made to get the baby transferred. Within the same breath, I believe it was the chief medical officer who says that there are 100 and something working ventilators, and that at no given time you're going to have 100 persons on ventilators. So why can't we get a ventilator? This is a second baby at this hospital right now who is in need of a ventilator.
Want a ventilator, and when they told me that she needs to be ventilated and that they're trying to get her transferred, and because they don't have none there, it was really shocking to me. You get me? And it's really sad to know that there's no ventilator at the hospital. And that is the reason why I really wanted to reach out. They reached out to Bustamante and UE and Cornwall Regional and Mandeville. None of that is successful. They don't have any they have ventilator, but they're saying that they don't have the space. At Mandeville, they're saying that they're short staffed. The doctors they're trying their best, but if them not have equipment, them how it go? There are lives that that they could have, that they can save. If them have all of the equipments them in place, but they really don't. I really want my daughter to, to get a ventilator. So I don't know if the Minister Tufton can see this and help, or Andrew Holness. I don't know what it is, but I really need my daughter to be on a ventilator ASAP, because this has been 3 weeks now. She has been fighting. She just really needs to go on the ventilator.
Report on the death of Leonardo Blackstock at the Mapen Hospital. Cabinet noted that the Southern Regional Health Authority has provided a summary report on the process that were undertaken to manage young Blackstock, who died on June 11, 2024 at the Mapen Hospital. Sarah's report details the efforts of the hospital to stabilize and manage the respiratory challenges that were experienced by baby Leonardo, and that the team followed the required protocol to have achieved a more positive outcome. While noting this tragedy and the effect that this death has caused on the family, members of Cabinet expressed their concern related to the case, spoke to the team from the Mapen Hospital who were present, including the senior medical officer, about what more could be done to improve the service delivery to minimize these negative outcomes. Cabinet was advised by the senior medical officer of the hospital as well as the chief medical officer that while equipment to support service delivery is necessary, the need for more specialized staff to include pediatric nurses, pediatric anesthesiologists, among the other technical staff, was critical for the management of neonatal intensive care units. Based on the report, Cabinet advised the ministry should expedite its plans in improving the health system to include the investments that are to be made in human resources for health and the capital investment program. In terms of newborn health, a general statement flowing from that previous report, Cabinet noted the advice of the health team that Jamaica experiences a high rate of birth during the months of September to December. However, the rates of premature deliveries are highest during the months of June to August. Accordingly, every year, plans are put in place to manage the increase in critical illness. Premature newborns are highly vulnerable to infection and other issues that may result in negative outcomes. These interventions are reviewed, and hospital pediatric services and NICUs are appraised of existing and new clinical management protocols and infection prevention and control system to reduce the level of infant mortality. In terms of ventilators, another subject matter brief to Cabinet, Cabinet noted the report of ventilators from the ministry and that ventilators are sensitive pieces of equipment that must be maintained on an ongoing basis in order to ensure the provisions of effective life-saving support. The ministry has conducted an audit to locate all the ventilators in the public health system. A statement that has been published from the audit, a total of 210 ventilators were located, and I think that audit was made public.
Moving right along, in this segment we're seeing where news broke out that Jamaica signs letter of intent with Philippines aimed at filling healthcare staffing gaps. So he had come out basically a few weeks ago saying that they have pledged to, train healthcare workers over a 5-year period. And so we don't know where that is going or where that stands right now. But we're seeing them saying they're trying to fill the gap. It is said that the Philippines is one of the largest trainers of healthcare workers in the world. Tufton quoted, "I signed a letter of intent with the Minister of Health Philippines in Switzerland at the World Health Assembly. We are now negotiating an MOU to pursue a bilateral agreement around health worker training, faculty exchange, and recruitment of health workers that are not available locally. We are going to exchange faculty to increase the ratio of faculty to student. Faculty from the Philippines are willing to come here. And thirdly, we are going to recruit hire Filipino workers, healthcare workers to come so that when we build our hospitals, we don't have an issue as we do now." And we know that similar arrangement has been made with Cuba, which Jamaica has had long-standing bilateral arrangement with. We have over 300 Cubans in our system now, mostly nurses. An arrangement was also signed with Nigeria 3 months ago, he shared, and there are discussions with India. And so I've had experience with working with some of these other countries that, has been listed here. And for the most part, I would say about 90% of them are really trained and can work. I've worked with a few where, trust me, it's like, me usually call them look and learn. It's like them look for see what you are do as a trained Jamaican nurse or midwife, and then they basically copy. And so I want to hear from one of my people, want to tell me what to think. Right, want to tell me what to think about this initiative in recruiting nurses from countries such as Philippines and even India. However, share your thoughts and opinion in the comment section, my people, and tell me what you think about all that was said in this video. What of this second mother now coming to cry out to expose and let us know that there are no ventilators at the Maypen Hospital on the pediatric ward at that, and that her baby, 11-month-old, is desperately in need of a ventilator. Share your thoughts, my people, make a reason. Don't forget to like, share, and subscribe to the channel. Run over to my other platform, Instagram and Facebook, and follow me over there at H0sp Rose. Check out the YouTube store, make a purchase. It goes in support of the channel. Check out the YouTube membership. You get a lot of benefits by becoming a member. Only a small fee per month to become a member of the H0sp Rose movement. Returning subscribers, big up on yourself. New subscribers, thanks for coming on board. New viewers, come on board, journey with me, join the family. Subscribe to the channel, like up the video, share out the videos, support the ABR movement by playing your part. On the road to 20K, help me to get there, my people. Stay tuned for more videos, stay tuned for more updates. Get this video to at least 2,000 likes. Big up on yourself.